British Columbia has set a grim new record this year for toxic drug deaths. According to the BC Coroners Service, there were 2,511 suspected unregulated drug deaths in 2023, a stark difference from a decade before when 334 unregulated drug deaths were recorded. BC's chief coroner has been calling for non-prescription safe supply of drugs, and the province's premier discussed his disagreement with this approach yesterday on Rosemary Barton Live.
I do not believe that the widespread distribution of drugs like opioids without that healthcare professional involved is the way forward. In fact, I think that's actually one of the ways that we ended up in this mess. And so making sure that those healthcare professionals are there supporting people and getting between people with addiction and predatory drug dealers, I think is so crucial.
Lisa Lapointe has witnessed the worsening problem firsthand as BC Chief Coroner for the last 13 years. She is retiring next month and joins us now to reflect on this deadly crisis. Lisa Lapointe, welcome back to the show. It's good to talk to you.
Thank you very much for having me.
This is one of the most seemingly unsolvable social policy problems the country is facing. And you have this disagreement with the Premier who says you can't distribute a safe supply of opioids without a medical professional being involved. What do you make of his argument there?
Well, I don't see this as a disagreement with the Premier. My job as Chief Coroner is to bring forward recommendations to prevent similar deaths from happening. And we have brought together a couple of death review panels now, which the Coroners Act gives us that ability, where we bring subject matter experts to the table, present them with the evidence, and ask them to come up with meaningful evidence-based solutions. And we, a couple of years ago, the Death Review Panel recommended the increased rollout of prescribed safer supply across the province in places, where people have really hard time accessing services, remote communities. And in fact, what we've seen since that time was lessening of prescribed safer supply. So the prescribed safer supply program is a good program, certainly provides supports for people, helps people move away from the illicit toxic drug market that we have, but it simply isn't meeting the needs in terms of numbers. We have 100,000 people with an opioid use disorder in our province, and estimates are that there are 225,000 people using substances. There are less than, and the numbers are shrinking, less than 5,000 people accessing prescribed safer supply. So it's just simply a matter of scale. No argument against prescribed safer supply, but it's just not capable of meeting the numbers of people who are at risk of dying.
Right, and when I said disagreement with the Premier, I didn't mean to imply there's a dispute and you're butting heads there. It's just he sees a different path than you see. And you've seen the larger debate on this has gotten very politicized, right? That and sort of made this a bit of a binary with people pointing to the increase in the drug deaths in British Columbia as proof that safe supply isn't working. How do we reconcile this, that you're advocating that safer supply maybe is a solution because dead people don't get into rehab, and others saying we can't have government giving people drugs, we need the government getting people into treatment?
Yeah, so a couple of things. There is very little safer supply in our province. So as I say, in terms of the ratio of people who are using toxic substances and the ratio of people who have access to safer supply, it's less than 5%. So for anybody to argue that safer supply is driving this crisis, it's illogical. The numbers just don't support that. And in fact, what we know is that fentanyl is driving this crisis, toxic, illicit fentanyl, not the substances that are prescribed under safer supply. We also know that BC and Alberta have been amongst the hardest hit provinces in our country as a result of the illicit toxic market. Alberta has taken a different approach. They don't have prescribed safer supply. They've been reducing harm reduction efforts. And in fact, their rate of death increased substantially more than British Columbia's in the first 6 months of 2023. And that's not to say that Alberta's approach is wrong. Enhancing treatment is critically important. We need to do that everywhere in our country. But it does imply that, it's not safer supply that is increasing the numbers here in BC, because Alberta saw an even greater increase and they don't have access to safer supply.
But yet, as you leave, you've had 2,500, more than 2,500 unregulated drug deaths in 2023, the highest number ever recorded. Even though the province declared this a public health emergency in 2016, we're still here. What does that say about the effectiveness of the approach and the ability of governments to solve this?
Yeah, I think governments have been taking a very cautious approach, wanting not to, not to appear to be doing anything too innovative. For so many decades, people who use drugs were really vilified as bad people. And, even no offense to media, but the media reports always show areas of town that seem dangerous and show people that, others say, well, that's not me, that can't be my family. And in fact, there are vulnerable people experiencing substance use everywhere in our province and in our country. And it's not going to change unless we do something radically different. And, the old response of the past, the punishing and the stigmatizing and pushing people into the margins, we know that wasn't effective. We know we've heard panel after panel, commission, group, the Canadian Association of Chiefs of Police, amongst others, saying we can't arrest our way out of this. This is a health condition. So it seems silly for us to be arguing about which health approach we should take. We need all health approaches. We need harm reduction. We need treatment where and when people need it. We need safer supply to keep people alive until we can build the treatment systems, because we haven't done that. We just don't have the infrastructure available. And, I hear people still vilifying people who use drugs. There are many people who use drugs who are actively looking for treatment and recovery options, and they just don't exist. The system just isn't available in our country. And that's going to take some years to build, and it's going to need investment, and it's going to need focus. And in the meantime, unless we are willing to do programs like prescribed safer supply and on a large scale, or regulated, thoughtful, careful access to safer supply, then we're going to continue to see people dying. Why people use substances, that's another question. But what we often see, it's pain. It's chronic physical pain, it's chronic emotional pain, it's trauma related to trauma in their past, it's related to acquired head injuries. People are using substances as a way of coping with pain, and that's a bigger issue altogether.
When you look at the way it's become a political issue and the way the debate has become politicized in a lot of corners around this, how does that affect the ability to find that sort of comprehensive range of solutions that you've laid out there? That it's not one magic solution, it's a series of different things for a series of different people, all with different underlying reasons and issues for being in this situation. How does the politics helping that, hurting that, getting in the way?
Oh, it makes me really sad when I see politicians using this issue to gain political favor. And I know that they are doing that on the backs of some of the most vulnerable people in our communities, people who are already suffering, and further stigmatizing them, trying to claim that they're bad people, that they're hurting us. I don't know about other provinces, but here in BC, there are virtually no families that don't know somebody who's died of a toxic drug crisis, died as a result of a toxic drug crisis, a toxic drug event. And they are people just like us. They're people in our communities. They're people who go to our schools. They're our next door neighbors, our colleagues' children, our colleagues' brother-in-law, people who found themselves in a difficult place and perhaps made a choice that wasn't the best one. And then once you have a dependency on opioids or other types of substances, it's really hard without help to move away from that.
Right.
We haven't had the help available for them. So polarizing this, trying to demonize people who use drugs as bad people, it's really, really disappointing. And it's a disappointing thing to see in those who would claim to be leaders, those who would want to be leaders, to try to gain leadership by vilifying and stigmatizing and actually causing harm to other people.
Lisa Lapointe, I appreciate your time and your perspective. That's BC Chief Coroner Lisa Lapointe. Thank you.
Thank you very much.